So, good morning, friends. Today we are going to deal with one topic in anatomy, that is the osteology of tibia and fibula. So, this is a very long subject. Of course, it's very tough to understand. I do know that, but I will try my best to make you understand by making this subject simplified. Okay. So, let us see the first one, that is the tibia. So, the tibia is the main bone of the leg, forming what is more commonly known as the shin of the leg. Shin is nothing but an elevation which is seen in the just below the knee joint. So it is the second, this tibia is the second largest bone in the body, which is situated on the medial side of the leg. The tibia is the pre-axial bone and it is homologous with the lateral bone of the forearm, called as the radius. The important function of the tibia is it carries weight from the body, just from the femur to the foot. Now coming to the main important basic parts of this tibia and fibula are, if you take this tibia, you can see this one, it is having one upper end and a lower end, and the upper end you can see there is one condyle called as the lateral condyle, and this is the medial condyle. How we understand the medial lateral condyles is, lateral condyle will have an articular facet for the attachment of the head of the fibula. Along with this, you can also see this is the medial condyle of the tibia, and now whatever shin, what I was telling you about the shin of the leg, this is nothing but the tibial tuberosity which is formed here, right? And you can see a sharp anterior border which is coming down. And if you come to the lower end of the tibia is narrow and it forms the medial malleolus, which is nothing but a projection which participates in the ankle joint. Coming to the fibula, this is the head of the fibula, and you can see the neck of the fibula, and this is the shaft of the fibula, and also this is the lateral malleolus. The lower end of the fibula forms the lateral malleolus of this ankle joint. And now coming to the posterior view, if you look at the posterior view, there are two eminences here. This is nothing but called as the intercondylar tubercles, and the eminence which is formed in between these tubercles is nothing but called as the intercondylar eminence. Along with this, you can also see an horizontal facet here, facet which is present here on the posterior surface of the tibia, which is useful for the attachment or the insertion of the semimembranous muscle. And also you can see a line, oblique line on the posterior surface of the tibia called as the popliteal line. And also if you come to the lower end of the tibia, you can see another one here called as the malleolar sulcus. This is nothing but the malleolar sulcus, and also this is the medial malleolus of the tibia. And towards the lateral side, this tibia will present a notch called as the fibular notch here. Okay, this is nothing but the fibular notch. And coming to the fibula, as usual I was telling you in this anterior picture, the posterior it is having a head and neck, and also this is the shaft of the fibula. And if you come to the lower end, it is presenting one part called as the lateral malleolus. Now let us see the parts of the tibia. The tibia is a long bone and is composed of three important parts. That is nothing but an upper end, a shaft, and a lower end. If you take the upper end, it is enlarged and bears notable medial and lateral condyles and also a tibial tuberosity. The medial condyle is bigger in relation to the lateral condyle of the tibia. Coming to the shaft presents three borders and three surfaces. The three borders are the anterior border, the medial border, and the lateral border. The three surfaces are the medial surface, the lateral surface, and the posterior surface. And coming to the lower end of the tibia, the lower end is small and it gives a small projection medially, which is nothing but called as the medial malleolus. This is the picture of the tibia, upper end of the tibia along with the knee joint. You can see the femur bone, and also this is the patella with the patellar tendon. And now you can see this patellar tendon getting inserted over the upper part of the tibia, that over the Gerardis tubercle. I will tell you what is that one. And here you can also see the fibula. Now coming to this borders and also surfaces. If you take the anterior surface of the tibia, the upper end of the tibia is showing. Now you can see clearly a lateral condyle and a medial condyle. This is a medial condyle. At the same time, you can see the tubercles of the intercondylar eminence. These are the two tubercles in the upper end of the tibia. And also you can see a roughened area here, roughened perforated area here. Okay. And now this is the tibial tuberosity. And you can see the shaft of the tibia. And also whatever lightly colored part is here, this is nothing but the site for the attachment of the three important muscles of the thigh region called as the sartorius, the gracilis and the semitendinosus muscles. And if you take the posterior surface of the tibia, upper end of the tibia, you are seeing again here a facet or a groove which is present here, which is useful for the attachment of the semimembranosus muscle. And also now you can see a colored part here, again small one. This colored part is nothing but for the attachment of the medial meniscus and also for the attachment of the posterior cruciate ligaments. And as I was telling you, on the lateral part of this over the lateral condyle of this tibia, you can also see an articular facet for the proximal head of the fibula. And again you can see, as previously I was telling you, there is an oblique line here which is going here, and you can see this oblique line is now, once it came down over the upper 1/3, bottom of the upper 1/3 of the tibia, this line is divided into two parts now, right? So this line, whatever is seen, oblique line, is called as the soleal line. As I told you, the shaft of the tibia was showing like three borders and three surfaces. You can see this is the anterior border where my cursor is there, and this is the medial border, and now you can see the lateral border, or otherwise called as the interosseous border. And with these three borders, there are three surfaces which are formed. This is nothing but the medial surface, and now coming to this one, this is the posterior surface, and this one which is there towards the lateral side is called as the lateral surface or the interosseous surface. So the medial surface is present between the anterior border and the medial border, while the posterior surface lies between the medial border and the lateral border, while the lateral surface lies between the lateral border and the anterior border. Now coming to the anatomical position. The side of the tibia is determined by holding the bone vertically in this type of manner that its expanded end with condyles will face upwards, its tibial tuberosity and also the sharp anterior border of the shaft will face anteriorly, and the medial malleolus is on the medial side, and finally the superior surface of the upper end, that is the tibial plateau, is in a horizontal position. This is the way how we have to hold the tibia in anatomical position, so that it will be easy in identifying the side of the bone. This is a picture to show you like the attachment of various muscles, that is attachments includes even the origins and also the insertions. You can see all the origins in red color and also the insertions in blue color. So coming to the upper end of the tibia and fibula, you can see that over the fibula you can see the insertion of the biceps femoris muscle, and also upper part of the tibia anterior surface you can see the insertion of the iliotibial tract. Coming to the fibula, there are few muscles, important muscles called as the Parodius longus muscle here. This is the Parodius longus. And now you can also see another muscle here which is coming from right from the upper end of the tibia and also over the fibula, extending toward the fibula. This is nothing but the extensor digitorum longus muscle. And now you can see this muscle here. This is nothing but the extensor hallucis from the tibia, which is taking its origin. And now over the fibula, lower 1/3 of the fibula, you can see there is another muscle called as the peroneus brevis muscle, and just below and medial to this peroneus brevis you will see the peroneus tertius muscle taking its origin. However, the main part of the tibia, that is the lateral surface of the tibia, shows the origin of one important big muscle called as the tibialis anterior muscle. Along with this, you can also see the insertion of very important tendon called as the quadriceps tendon, that is via patellar ligament. This is the place where this quadriceps femoris muscle will get inserted through the patellar tendon. Along with this, coming to the insertions of other muscles on the medial surface of the upper end of the tibia, there are three important muscles which get inserted, one being the sartorius, okay, most laterally. Then medially, then medial to the sartorius, you will be seeing the gracilis and also the semitendinosus muscles. And coming to the posterior surface of this leg, On the posterior surface, as I was telling you, there is a horizontal groove, and this horizontal groove is useful for the insertion of the semi-membranous muscle. Along with this, you can also see just below supromedially to this soleal line, you can see one muscle which is getting inserted called as the popliteus muscle. And just below the popliteus muscle, you can see the soleus muscle and also the tibialis posterior muscle here. And now you can see other origins of few muscles called as the flexor digitorum longus muscle over the tibia, and also the flexor hallucis longus muscle over the fibula region. And also in the lower one third of the fibula, you can also see the origin of the peroneus brevis muscle. And coming to the calcaneal region, this is the calcaneum bone of the foot region, the important bone. Here you can see the insertion of first small insertion is there, wherever my cursor is there exactly, that is the place for the insertion of the plantaris. And now the larger one which is there, this light blue colored one, this is the site for the insertion of these gastrocnemius muscles via calcaneal tendon, or otherwise called as the tendo Achilles. Let us see in detail about this tibia. The upper end of the tibia, so the upper end is markedly expanded from side to side to form two large condyles which overhang the posterior surface of the shaft. The upper end includes a medial condyle, a lateral condyle, an intercondylar area, and also a tuberosity. So these are all the important parts of the upper end of the tibia. Let us see in detail about each of them. If you take this picture, you can see this is the medial condyle of the tibia, and this is the lateral condyle of the tibia, and you can see this is the superior articular facet for the head of the fibula, right? Now let us see the upper end of the tibia. If you take the upper end of the tibia, it is having various structures which are placed in position. So this is the tibial tuberosity. Okay, this is nothing but the anterior end of the tibia. Now if we start from the posterior part, you can see the posterior most structure is nothing but the posterior cruciate ligament. Okay. Now from this posterior cruciate ligament, just in front of that, you can see the posterior attachment of the medial meniscus. From the posterior attachment of the medial meniscus, if you see, you can look up this picture, you can see an C-shaped, okay, oval or C-shaped structure called as the area for the articulation with the medial meniscus. This is all the medial meniscus. And now in between you can see two eminences here very clearly. These are nothing but the tubercles of the intercondylar eminence. And now if you further move towards the anterior end, you can see anterior attachment of the medial meniscus here, and now you can see a rough perforated area here. Okay, and then behind this anterior medial meniscus, you can see the attachment of the cruciate, that is the anterior cruciate ligament. Okay, and now this is just behind that, you also now see the attachment for the lateral meniscus, that is nothing but the anterior attachment of the lateral meniscus. So from here the lateral meniscus is starting. Now see, you can see this rounded lateral meniscus which is smaller when compared to the medial meniscus. So this is the area of articulation for the lateral meniscus. Then finally again, once you reach back here, then you can see the attachment of the posterior cruciate ligament. So there is a mnemonic to remember the structures which are present over the upper end of the tibia. I will tell you back again. So please remember, like, it's very easy to remember. Medical College London, London Medical College. I will tell you. Please remember this mnemonic. Medical College London, London Medical College, from anterior to posterior side. So if you take a dissected part of this tibia, you can see this is the opened knee joint with this one. This is nothing but the patella, and you can see this one. This is the patellar ligament, and now you can see the lateral meniscus. And this small area, whatever you are seeing, this is a bony area, that is nothing but the lateral tibial condyle. And now you can see the anterior cruciate ligament here, and also the posterior cruciate ligament here. And now if you come to the medial side, see, this is a very clearly, you can see this one. This is a medial meniscus along with the medial tibial condyle here. Okay, this is a picture to make you understand like how this menisci and also the cruciate ligaments are organized within the knee joint. Coming to the tibial plateau, the condyles form a flat surface known as the tibial plateau. So this structure articulates with the femoral condyles to form the major articulation of the knee joint. Let us see about the tibial condyles. The medial condyle has got mainly two features. That is, the surface of the medial condyle is oval along the long axis in conformity with the medial femoral condyle and the meniscus. So now we are comparing the structure or the shape of the medial condyle of the tibia with the medial femoral condyle, that is the medial condyle of the femur, because both of them have to articulate. And it has a transverse groove on the posterior aspect of the insertion of the semimembranosus muscle. Now coming to the lateral condyle, it also shows two main features. The lateral surface is little smaller. It is little smaller as just now I have shown you in the picture, and more nearly circular in shape in conformity with the lateral femoral condyle and meniscus. It has a smaller facet for the head of the fibula. This is one picture to show you the medial and lateral condyles. You can see anteriorly, you can see the posteriorly, you can see the posterior intercondyle area here, and now this is the head, neck, and of the apex head and neck of fibula. And anteriorly, you can see the tibial tuberosity, and now clearly you can see this is the intercondylar area. Okay, and this is the lateral condyle, medial condyle, and also the parts of the fibula. Now the attachments on the medial condyle. The semimembranosus muscle, as I was telling you, over the posterior surface of the medial condyle, the semimembranous muscle is inserted into the groove on its posterior surface. Along with this, the capsular ligament of the knee joint is also attached to the upper border, which also gives attachment to the deeper fibers of the tibial collateral ligament. The medial patellar retinaculum is also attached to the anterior surface of the medial condyle of the tibia. Coming to the attachments of the lateral condyle. The iliotibial tract, it is attached to the flattened neck impression on the anterior surface. The capsular ligament of the superior tibiofibular joint is attached around the margins of the fibular facet. The origins of the extensor digitorum longus and of the peroneus longus extend onto the lateral condyle near the fibular facet. And lastly, the groove which is present on the posterior surface of the lateral condyle, this groove is occupied by the tendon of the popliteus muscle with a bursa in order to avoid the friction. Now an important point called as the Girdis tubercle. What is this Girdis tubercle? This Girdis tubercle or tuberculum girdi is a smooth triangular shaped facet which is present in the proximal end of the tibia. Basically, it is seen over the anterolateral surface of the lateral condyle of the tibia, and this region is the important region where the iliotibial tract gets inserted. So I'll show you in the picture. So you can see the Girdis tubercle, which is a near triangular facet in a colored part here. This is the Girdis tubercle, and this is the lateral condyle of the tibia, and this is the medial condyle of the tibia. So this Girdis tubercle is a flattened prominence on the anterior surface of the lateral tibial condyle, and it receives the distal end of the iliotibial tract. So whenever you say Girdis tubercle, please remember that it is seen on the anterolateral surface of the tibial upper end of the tibia. Now the medial condyle. Just to give a brief description again, conclusive part about the medial condyle. The superior surface of the medial condyle, the peripheral flattened part is covered by the fibrocartilaginous plate, the medial meniscus. Posteriorly, it presents a deep transverse groove for the insertion of semimembranous muscle. And anterior and medial surfaces of the medial condyle, the anterior and medial surfaces are marked by the vascular foramina, and adjoining margins gives connection to the medial patellar retinaculum. Coming to the lateral condyle, concise about this lateral condyle, the superior surface of the lateral condyle is flattened peripheral part, and it is covered by a plate of fibrocartilage that is nothing but called as the lateral meniscus. The posterior surface, inferiorlaterally, this surface presents a circular smooth articular facet for the head of the fibula. Between the articular facet for the fibula and the margins of the superior surface, there is a shallow groove for the tendon of popliteus muscle. The anterior and lateral surfaces of the lateral condyle, they have a flat triangular facet called as the Girdis tubercle, which is useful for the insertion of the iliotibial tract. Along with this, the anterior and lateral surfaces supply connection to the lateral patellar retinaculum. Now coming to the intercondylar area of this upper end of the tibia. This intercondylar area is a roughened area on the superior surface of the upper end of tibia, which is present between the two articular surfaces of the two condyles. The middle of this intercondylar area is narrow and marked by an elevation referred as the intercondylar eminence. So this consists of two tubercles and a roughened area. This area is the main site for the attachments of the ligaments and menisci of the knee joint. So this tibial intercondylar tubercles fit into this intercondylar fossa of the femur. So from before backwards, the structures which are there in this intercondylar area there are 6 structures which are arranged in a sequential manner over this intercondylar area. That is from before backwards, that is nothing but from front to back. These are arranged in this fashion, that is anterior horn of the medial meniscus, the anterior cruciate ligament, the anterior horn of the lateral meniscus, the posterior horn of the lateral meniscus, the posterior horn of medial meniscus, and the posterior cruciate ligament. So if you take a mnemonic, excuse me just a minute, I have an emergency call. Hello? In class, I'll call you back. So, if you take this intercondylar area, it gives attachment to the 6 structures. How to remember these 6 structures is nothing but with the help of one simple mnemonic called as, you can see, Medical College London and London Medical College, right? M stands for the medial meniscus, C stands for the anterior cruciate ligament, that is cruciate ligament, and L stands for the lateral meniscus. Again, London Medical College, that is L starts for the lateral meniscus, M stands for the medial meniscus, and again C stands for the cruciate ligament. I will just show you this one again in this picture to make you clear. Yes, this is the anterior end, right? This is the anterior end of the tibia, that is the tibial tuberosity can be seen, right? So if we start from before backwards, right? I am going from before to backwards. You can see I said like what I said here. Medical College London and London Medical College, right? Let us see this one. So I am going from before backwards. So Medical College London, M, Medical College, M. This is nothing but the anterior attachment of the medial meniscus. Medical College, C. This is now you can see this is nothing but the attachment of the anterior cruciate ligament. Medical College, yes, London, L. This is now you can see the attachment of the lateral meniscus. Okay, so Medical College London and then London Medical College. Now I am coming to L. Okay, this is the London. So it is attachment for again for the posterior attachment of the lateral meniscus. Okay, London Medical College M. This is nothing but the attachment, that is the posterior attachment of the medial meniscus, and London Medical College C. This is nothing but the posterior attachment of the cruciate ligament, that is the attachment of the posterior cruciate ligament. So please remember this mnemonic, and it is a short question for you in the examinations. So now this is another picture to show you how these are arranged. Now let me show you the tibial tuberosity. This tibial tuberosity is a large bony projection in the apex of the rough triangular area situated on the anterior aspect of the upper end of the tibia. So this tibial tuberosity, it will split into an upper smooth area and also a lower rough area. The upper smooth part gives connection to the ligamentum patellae, while the lower rough part is linked to the subcutaneous infrapatellar bursa, which divides it from the skin. The rough triangular area above the tuberosity is linked to the deep infrapatellar bursa. Coming to the shaft of the tibia, the tibial shaft appears as a 3-sided prism, wherein it has got 3 borders and 3 surfaces. As I told you in the earlier, the 3 borders are the anterior, medial and interosseous or the lateral borders, and the 3 surfaces are the lateral surface, the medial surface and the posterior surface. Let us see about these borders. The anterior border, which forms the shin of the tibia, it is the sharpest, subcutaneous and sinuous in course. It is subcutaneous and forms the shin. It is distinct in the upper 2/3 of the tibia only. So it is more elevated and it is more distinct in the upper 2/3 of the tibia. And this anterior border, it extends from the tibial tuberosity above to the anterior border of the medial malleolus below. Coming to the medial border, it extends from the medial condyle of the posterior border of medial malleolus, and this medial border is more prominent in middle 1/3 of the shaft of the tibia. Along this medial border, the soleal line joins the medial border in the junction of its upper 1/3 with the lower 1/3 of the shaft of the tibia. Coming to the lateral border or the interosseous border, it is sharp and goes from lateral condyle below the facet for the head of the fibula to the anterior border of the fibular notch. In the beginning, I have shown you in the lower end of the tibia, it will show one notch called as the fibular notch, right? So here it ends. The interosseous or the lateral border is distinct in the middle 1/3 of the shaft of the tibia. It gives connection to the interosseous membrane, which connects the tibia and the fibula. Its distal part breaks up to enclose a triangular notch for the connection of the interosseous inferior tibio-fibular ligament. Coming to the surfaces of this shaft of the tibia, the medial surface is completely anteromedially and is located between the anterior and the medial borders. It's just about solely subcutaneous. Its upper part near the medial border gets insertions of 3 muscles. Those 3 muscles from before backwards are the sartorius, gracilis and the semitendinosus, as I have shown you just now in the previous pictures. Coming to the lateral surface, it is directed anterolaterally and is located between the anterior and the interosseous borders. Its upper 2/3 gives origin to the tibialis anterior, and the lower 1/3 is crossed by these structures from medial to lateral sides while going from leg to the foot. These structures are the tibialis anterior, the extensor hallucis longus, the anterior tibial artery, deep peroneal nerve or otherwise called as the anterior tibial nerve, the extensor digitorum longus and the peroneus tertius. Coming to the posterior surface, it is located between the medial and the lateral borders. It has 2 lines, one is called as the soleal line and also there is another line called as the vertical line. A rough bony ridge goes from the fibular facet to the junction of the upper middle thirds of the medial border named as the soleal line. So this soleal line gives attachment to these structures from above downwards, that is from top to bottom. So this soleal line gives attachment to the fascia covering the popliteus top, just below that fascia covering the soleus muscle, and below that the origin of the soleus muscle itself, and finally at the bottom level it gives attachment for the deep transverse fascia of the leg. Coming to the vertical line, this vertical line has divided a large area below the soleal line, is split into a medial and lateral part by a vertical ridge. The nutritional foramen of the tibia is situated at the upper end of this vertical ridge. The flexor digitorum longus originates from the medial area below the soleal line, while the lateral area gives origin to the tibialis posterior muscle. So please remember, this soleal line is very important because the vertical line extends from this soleal line only. Now coming to the shaft, the lower quarter of the posterior surface underneath the flexor retinaculum is associated with these structures from medial to lateral side. So from medial to lateral, these are the structures which are related. Those are nothing but the tibialis posterior, the flexor digitorum longus, as just now I have told you, and the posterior tibial artery. Then comes the tibial nerve, and the most lateral one being the flexor hallucis longus. This is the lower end of the tibia. You can see this is the medial malleolus and also the articular facet of the medial malleolus, and this is the inferior articular facet, and you can see the medial malleolus here and also the lateral malleolus here. Now coming to the lower end. The lower end of the tibia is slightly expanded. It widens to help the weight bearing, and it has got 5 surfaces. Medially it is prolonged downwards as a medial malleolus, as I told you. On the posterior surface of the tibia there is a groove where the tendon of tibialis posterior will pass through that groove, and laterally on the distal end there is a notch. Laterally there is a notch where the fibula is bound to the tibia. This is nothing but known as the fibular notch. Coming to the anterior relations, that is for the lower end of the tibia. The anterior aspect of the lower end of tibia is crossed by the tendons of the following muscles. So how these tendons cross is like now from medial side of the tibia towards the lateral side. That is, I am starting from the medial medial malleolus towards the lateral malleolus. So from medial to lateral, they are the tibialis anterior muscle, extensor hallucis longus, extensor digitorum longus, and the Parodius tertius. These are all the muscles which cross this lower end of the tibia, that is anterior aspect, from medial to lateral side. The anterior tibial vessels and the deep peroneal nerve cross the anterior aspect of the lower end of the bone lying between the tendons of extensor hallucis longus and the extensor digitorum longus. Coming to the posterior relations of the lower end of the tibia. The posterior aspect of the lower end of tibia is crossed by the tendon of following muscles. See, anteriorly we have seen few muscles. Now posteriorly also there are few muscles which are crossing from medial to lateral side. They are nothing but the tibialis posterior muscle, the flexor digitorum longus, and flexor hallucis longus. The tendon of the flexor digitorum longus crosses that of the tibialis posterior near the lower end of the bone. And the posterior tibial vessels and nerves cross the posterior aspect of the lower end of the bone lying between the tendons of the flexor digitorum longus and the flexor hallucis longus. This is all about the ossification, osteology of the tibia, and now let us see the ossification of this tibia. This tibia, please remember only three general points about the ossification. The tibia ossifies in three centers, that is, one primary center will be there and two secondary centers will be there. The primary center appears in the middle of the shaft at the about 7th week of intrauterine life. And the secondary centers for the upper end, which fuses by 20 years, and for the lower end, which fuses by 18 years. Coming to the fibula. The fibula is the lateral bone of the leg and is homologous with the ulna of the forearm. In Latin term, the fibula means nothing but it's a pin. Therefore, please remember, fibula is not a weight-bearing bone. It is only there to give space for the attachments of the muscle of the legs. So I am going to read it now. In Latin, the term fibula means pin. Therefore, the lateral bone of the leg is rightly referred as fibula because it looks like a long pin-like bone. It's a long, thin postaxial bone of the leg and will not take part in transmission of the body weight. Its main function is to act as an attachment for the muscles and not as a weight bearer. Coming to the articulations of the fibula, it has three main articulations. The proximal tibiofibular joint, which articulates with the lateral condyle of the tibia. The distal tibiofibular joint, which articulates with the fibular notch of the tibia. And finally, the fibula will also participate in the ankle joint, wherein it articulates with the talus bone of the foot. Parts of the fibula. The fibula has got three parts, that is the upper end, lower end, and a shaft. The upper end is round and presents a circular facet. An upward projection posterolateral to this facet is termed as the styloid process. Coming to the shaft, it has anterior, interosseous, and posterior borders, and it is also having medial, lateral, and posterior surfaces. But however, please remember that only interosseous border is clear in the case of fibula, and all other borders and surfaces are vague. The lower end of this fibula is flattened. It is flattened when compared to the upper end. See, the upper end is rounded while the lower end is flattened and bears a triangular facet on its medial surface, which is useful for the articulation with the talus. Behind and below this there is a roughened fossa which is present, called as the malleolar fossa. How to determine the side and also the anatomical position of the fibula? In order to identify the anatomical position and side, the side of the fibula can be set by holding vertically in such a way that its rounded upper end, called as the head, should be directed upwards, and its comparatively flattened triangular end should be pointed downwards, and a triangular articular facet is seen over the lower end, okay, which will be facing medially for the attachment to the talus bone of the foot, and also Laterally, there is a depression at the lower end which is located behind and below the triangular articular facet of this end. The upper end of the fibula, it is slightly expanded in all directions. The superior surface bears a circular facet, that is articular facet, which articulates with the lateral condyle of the tibia. The apex of the head or the styloid process projects upwards from its posterolateral surface. The constriction immediately below the head of the fibula is now known as the neck of the fibula. Coming to the head is round and bulky. It presents the three following important features. An oval or circular articular facet on its superior aspect for articulation together with the lateral condyle of the tibia. The second feature is a styloid process posterolateral to the articular facet, which gives connection to the fibular collateral ligament. And the third important feature is a sloping surface in front of the styloid process for C-shaped insertion of biceps femoris. Please remember these important three features of the head of the fibula. Coming to the neck is also a constriction below the head of the fibula, and the common peroneal nerve is associated with the posterolateral aspect of the neck and anterior tibial artery on its medial aspect. This is the only clinical importance for the neck of the fibula. So with this, we have completed the osteology of tibia and fibula, and I request you all to immediately open the osteology and start reading about this tibia and fibula, because I do know that it will be very tough to understand, like what are the muscles which are crossing from medial to lateral, what is the arrangement of these tendons and menisci and cruciate ligaments. All these things are very tough for you, but however, I request you all to kindly read the osteology immediately, open your textbooks so that you can at least understand a little part of the subject. Thank you.